As you're aware, Galway University Hospital is experiencing really significant pressures in relation to the numbers of patients on trolleys, and clearly that's something that's unacceptable, I'm sure, to all of the staff in the hospital and to GUH management and also to Saolta management. So clearly we have decided that we are going to embark on a targeted intervention that's going to address in relation to the numbers of patients on trolleys and to try to reduce that. Clearly we've had high numbers, we've had up to 80 patients on trolleys on certain occasions, and that's a huge patient risk and it's unacceptable. So clearly in relation to, we are aware that the staff have played a tremendous part in dealing with a very difficult situation, and I suppose they have been under undue stress, and it's been very distressing for both patients and for their families. So this targeted intervention is something that we are going to embark on as of from next week, and clearly it's to address patient flow, the patient's journey throughout the hospital, and clearly it starts at the front door. We're going to look at how we can actually introduce measures in terms of patient flow, medical cohorting and surgical cohorting, ensuring that the patient goes to the right ward so that they can actually try to reduce the length of stay, and also then working with our community colleagues then in relation to discharges and addressing any blockages in that pathway as well. So myself and Pat would like to, I suppose, advise staff today that this is something that we are really committed to, and we are setting up daily regular meetings in relation to the situation so that we can actually set targeted measures to improve the situation. I'll hand you over to Pat.
Thanks, Chris. I think just to reinforce again what Chris is saying, that this is a targeted intervention over the next 6 weeks. We want to be sure that we've addressed any potential delays in the patient care, the patient pathway through the hospital. We know we need additional capacity, but that's going to take a number of years, and the current high numbers is unsafe for patients, and none of us want it, and we want to ensure that we minimise any potential delays. So this is a focus by the hospital and the hospital group to look at all potential delays and to see what solutions we can get to address them, in particular with getting access to diagnostic tests such as radiology, cardiology, etc., looking at access to specialist input, looking at access to discharge issues. So we want to be sure that there's no potential delays for patients other than them getting clinical care. And I think the 6-week intervention is to look at all of that and to make sure and to assure you that we're putting everything into this. This is the #1 priority for me and for Chris and for all the hospital and the group management team, that we have to try and minimise the number of patients on trolleys for the shortest period possible.